patient's hip in the resting position, 30-30 with a little extra rotation. Now, a couple things to note here is that when Freddie has this belt around, well, first he's got a belt around the waist to kind of keep them from moving. And it might be required because we're moving in this direction in the frontal plane, and the patient's hips may shift. If their hips are shifting, you're going to need to have a belt there. So let's actually do it with the belt. We'll use this one first. So let's go ahead and hold that one across your ASIS. So snug, but not uncomfortable for them. And then you're going to have a second belt that you're going to use. And then you're going to have to adjust this table. Yeah.
Just note of caution with the high-low tables, depending on what kind of high-low tables you have, when you put that first stabilizing strap on, if you adjust the height, make sure that you're not squeezing the guts out.
It's happened.
We've done that before.
Oh, yeah.
I've done it before.
And then the student lays there and goes, the one that's the patient, you're like, you okay? And I don't want to get the other person in trouble.
I know you would. I wouldn't, though. I'd dab on a grenade for it.
All right, so the next thing we're going to do here is this. All right, take around in there. So here's what I need you to do. This belt has got to go right up against your right up against your pubis. Okay, so we're going to do this. Take it right up in there, tuck it up there, and hold it in there for a second. There you go. Good. All right, now that looks good. You drop this down just a little bit, like that. Does that hurt when I pull on it? It's comfortable. Okay. Can you guys see this? Okay. Can someone turn the light off, please? Okay, a couple of things I will just say to you is you'll notice Freddie's hands, if you look at Freddie's hands, he's got one underneath here, he's got the other one on top here, and he's basically trying to hold the hip in place. But I'll tell you, in the old book, and I like the old book better, he has one hand on the lateral side of the knee, and he actually puts it up underneath here to kind of help keep it in flexion. And then the other hand, he actually puts on the ASIS on this part of the body to kind of stabilize that hip from coming over. And just in this position, all they do is they lean straight back. And it's a lateral traction. Okay? It's a little bit more on the setup, but it's not a big deal. Okay? Now this particular hip traction, if you go to page 302, yeah, 302, it can be done in more flexion. So all you would simply do is take the person up in more flexion, just readjust your hands. You can do lateral traction. You can take them up close to 90 degrees, and you can hold their leg like this, and perform lateral traction. It would be best if I could get you in like this.
What doesn't make sense as a lateral flexion?
There you go. I can perform a lateral traction flexion in about 90 degrees. Or I can move the person towards almost near extension. I can put something down here a little bit lower, bring the belt down, and do it more towards extension. So figure 74B is showing it in more flexion, in more of a flex position. Okay, and then in this case it shows the leg in the air. You can do that. Or 74C, more in an extended position. And then on page 301, 74A in the resting position. Okay? So what I'd like you to do first is to perform the mobilization in the resting position. Get a feel for that. And then try flexion or extension. Yes.
Can you just show your? I couldn't see where your hand
You
was.
know, let
on
me
the
do it
hand.
on this other side. I'll just slide over. You know, you loosen that up, or you keep coming. There you go. Good. So. You know what to do with the belt, right? You got it in there. Excellent. This right hand on the ASIS right here, and this left hand underneath the knee, maintaining that. Now I want to take her down a little bit more, or less, and then straight out. Now this is a different position of the hand. If you look at Kaltenborn, he actually has one hand like underneath here and the other one's here. It's not as stable. The person rolls. And for some reason he changed it. But in the old book, one here, straight out. Okay, much more stable.
You can see the femur translating laterally as opposed to adduction, but when he does it the other way.
Yeah, when I did it this way,
as well.
see how she kind of rolls.
One of the adductions.
Yeah.
Yeah, that other counter, that down, the distal hand